Namaskar. Welcome you all for this presentation on the application of rasoushadhi, herbomineral formulations in the management of psychiatric disorders. At the outset, let me thank the organizers, especially Dr. Ravi Prasad Hegde, a specialist in Manas Roga from the Department of Kaya Chikitsa, Advas Ayurveda Medical College, and also principal of Advas Ayurveda Medical College, Dr. Zenica D'Souza, for giving me this opportunity. This is a re-recorded version of the same lecture. So let us begin this topic. It is entitled as Application of Ayurvedic Herbomineral Formulations in Psychiatric Disorders. Rogan asheshan apahanti tushta rushta tu kaman sakalan apishtan Tvamashritanam navipannaranam Tvamachrita hi ashtayatam tayam. When you observe the term psychiatric disorder, let us see how it is defined in Western literatures. Psychiatric disorder is a mental disorder. It's also called as a mental illness. Is a behavioral or mental pattern that causes significant distress or impairment of personal functioning. Hopefully we can use the term manovikaraha as a broad term, an umbrella under which all these psychiatric disorders can be considered. If we try to define manovikara, it is an abnormal mental condition characterized by visheshan of sharirika and manasika doshas, impairment of manokarma, that is abnormal chintya, abnormal vicharya, abnormal uha and sankalpa, or maybe presence of alpasattva, abnormal cheshta, and also abnormality or vibramsha in buddhi, achara, bhakti, etc. If you see the types of manovikara, it may be mano-adhishtita manovikara, that is purely psychic-based disorders, or it may be ubhayadhishtita manovikara, where both psych and soma are involved. And ubhayadhishtita manovikara may be Manaha Shariradhishtita Manovikara, which we can mention as psychosomatic disorders, where psychic component is higher, or Sharira Mano-Adhishtita Manovikara, where we can term it as somatopsychic disorders. Apart from this, we have an Anatmaja Manovikara, purely related with Vata. And some people also consider other perversions like kumbhika, etc. under the classification of manovikara. If we see classical types in our texts, we will find unmada, apasmara, atattva abhinivesha, then kayasattva rupa vikaras. If we try to use a broad classification, hopefully we can consider under these categories manasa vikara, which probably can be correlated with the neurosis, that includes abhyasuya, that is jealousy, bhaya or fear, chittodveg or anxiety, dainya or meanness or inferiority complex, harsha or exhilaration, kama, desire, krodha, anger, lobha, greed, mada, arrogance. In this context, mada also means intoxication or alcoholic psychosis in other context. Moha, that is confusion, shoka or grief, vishada, which may be anguish. It can also be considered under depression, and irsha. Under Nanatmaja manasa vikara, we can see chittodvega or anxiety. Again, vishada, which may be anguish or depression. Ashabda shravana, auditory hallucinations. Tama, that is withdrawal. Atipralapa or prattling. Aswapna or insomnia. Anavasthita chittatva. Atripti, that is discontentedness. Tandra or stupor. Excessive sleep or atinidra, and maybe bhrama or confusion. Under ubhayatmaka manovikara, psychosomatic or somatopsychic, we can have unmada, apasmara, apatanaka, apatantraka, atatva abhinivesha, madatyaya, and sannyasa in one side, and on the other side, where we have a psychic component resulting in physical diseases like kamajwara, krodhajajwara, bhayajatisara, shokajatisara, etc. Probably unmada is a condition which we will have to address with much focus and much details. Most of these psychiatric conditions come under unmada. In texts like Charaka Samhita, unmada and apasmara are exclusively dealt in two different chapters, in Nidhanasthana and also Chikitsasthana. Atatva Abhinivesha is contextually explained. So here I am not focusing on apasmara because it has got other components and also other symptomatic presentations. There are many formulations which are definitely useful in both unmada and apasmara equally. They will be dealt, but I am not talking about apasmara in this presentation. I will be probably focusing on unmada alone. In unmada, you know that greatly deranged bodily doshas travel to the upper part of the body. They distract the normal state of mind, causing a condition known as unmada. In Charaka Samhita Nidhanasthana, 7th chapter, shloka number 5th, Acharyas mentioned, greatly deranged bodily doshas have been correlated to the manifestation where different factors of the mind are affected. A beautiful sentence is mentioned. It is said, Unmadam punaha mano buddhi samjna jnana smriti bhakti shila cheshta achara vibramam vidyat. Here we do find certain terms. Let us try to understand them in a better fashion. Samjnam means jnanam. Samjnam, jnanam. Tad vibhramat. What happens? Yat agnyadidaham na buddhyate. Person will not be able to appreciate or perceive the sensations like sense of heat. Agnyadidaham. That means in an advanced stage of dementia, person will not be in a position to feel such senses. Also, Acharya says that there is another important meaning for the term samjna. He says, samjna namollekena jnanam. That is memory or remembering of names. So this is a very common that many people fail to remember names. They are unable to recall the names or recall the numbers. So this type of knowledge is also referred as samjna. So samjna vibhrama or derangement of samjna is observed in unmada. Further it is said, smriti vibhrama. Smriti vibhramatu na smarati. Ayathat va smarati. Person may forget the things. He will not be able to recollect the things, or ayathavatva smarati. He will remember something wrong, incorrectly. That is also called as a part of smriti vibhrama. Bhakti ichha. Tad vibhramat cha yatra ichha purvamasit tatra anichha bhavati. So bhakti, the word here refers to ichha or desire or likings. A person might have had likings towards certain materials, certain foodstuffs, certain sweet, certain people, certain types of music. But now he is not having interest in them. He is not having likings in them. So, Purvam Ichha Asit. But now Tatra Anichha Bhavati. So, this is observed in the case of Bhakti Vibhrama. Next word mentioned here as Shila. Shila Vibhramat Akrodhana Krodhano Bhavati. Person who was calm and quiet gets agitated. He shows irritability. He becomes angry without any reasons. So that is a presentation of Shila Vibhrama. Next, Cheshta Vibhramat Anuchita Cheshto Bhavati. Person will show some attitude, some behavior which is absurd, which is not acceptable. He will show behavioral abnormalities. So that is because of the Cheshta Vibhrama. Acharaha Shastra Shiksha Kruto Vyavahara Tad Vibhramadya Shaushadya Charati. Here, Achara, the word refers to Shastra Shiksha Kruto Vyavahara, or an education that the person has received and the knowledge that he developed. That is Achara. Achara also means whatever that a person has studied after his birth, everything comes under Achara. That means the trainings, the trained behavior, knowledge obtained by training, everything will be forgotten step by step in Achara Vibhrama. Simplest example is a toileting. A baby doesn't know. As it grows up, it is trained and it knows that it has to go to toilet or it has to go to latrine or directory. And that particular knowledge is affected in advanced stage of dementia and Alzheimer's disease, which you might have observed. Person may defecate inside the room. So that is the situation which can occur in Achara Vibhrama. So in Unmada, all these various factors, Samjna, Jnana, Smriti, Bhakti, Shila, Cheshta, Achara, are affected. That means a number of psychiatric conditions come under the umbrella of Unmada. If you see classical types in texts, it is very obvious. Vatika, Paitika, Kafaja, Sannipatika, Agantuja and Bhutonmada are mentioned in Charaka Samhita Chikitsa Sthana. Agantuja or Bhutonmada are considered as same in Charaka Samhita. Whereas in Sushruta Samhita Sutra Sthana 62nd chapter, 6 types of Unmada are mentioned: Vataja, Pittaja, Kafaja, Sannipataja, Manogata Dukkha and Vishaja Unmada. And in Ashtanga Hridaya Uttara Tantra, Vataja, Pittaja, Kafaja, Sannipataja, Adhija and Vishaja types of Unmada are mentioned. Anyway, let us not go for the details, because today's topic is focusing on herbomineral formulations that are applied in psychological disorders. But a couple of sentences on Bhutonmada is essentially to be mentioned here, because many of rasoushadhis that are mentioned have a very unique and specific indication in Bhutonmada. This Bhutonmada or Grahonmada is a psychiatric condition characterized by abnormal behavior in terms of exhibition of strength, energy, valor and enthusiasm, or defects in perception, retention and memory, abnormality of speech, and abnormality in perceiving self and environment. In Sushruta Samhita, 8 types of Bhutonmada are mentioned. According to Charaka Samhita, there are 11 types of Bhutonmada. In Ashtanga Hridaya, under the heading of Graha Roga, 18 types are described. So this is in short about psychological illnesses, or Unmada to be specific, described in Ayurveda. This is just a basic material so that we can enter into the topic in a systematic way. A couple of sentences on modern view also. This Unmada can be correlated with a psychological dysfunction within an individual associated with distress or impairment in functioning and a response that is not typical or culturally expected, which is abnormal, which is never expected by that individual, and it is not accepted culturally also. We can say that it is a breakdown in cognitive, emotional, or behavioral functioning. There are a number of classifications depending upon various psychiatrists, psychologists, authors. To quote a few, it may be psychosis, psychoneurosis or neurosis, psychosomatic or somatoform disorder, substance-related disorder, sexual and gender identity disorder, psychological disorder of childhood and adolescence, eating and sleep disorder, adjustment and personality disorder, psychiatric disorder of old age, etc. In modern management, mainly they consider psychotherapy, then drug therapy, then physical therapy that may include ECT or psychosurgery. If you are talking in terms of Ayurvedic management, that too Ayurvedic management of Unmada, which may be psychosis or schizophrenia-like conditions, Snehana, Svedana, Vamana, Virechana, Shiro Virechana. Especially Shodhana is very important because Unmada and Apasmara are considered as Bahudosha Avastha. Naturally, Shodhana is indicated. So, Vamana and Virechana are the primary treatments that are advocated, whenever possible, of course. In Unmada Chikitsa, when line of treatment is mentioned, that includes removal of etiological factors, Samshodhana Chikitsa. The described principle of management is like this. In Vataja Unmada, Snehana followed by Mrudushodhana. In Pittaja Unmada, Virechana. In Kafaja Unmada, Vamana. After elimination therapy, after Shodhana, Samsarjana Krama, that is dietetic regimen, has to be followed. Then, of course, Samshamana Chikitsa. This Samshamana Chikitsa includes use of different single and compound herbal and herbomineral formulations. We also follow psychoshock therapies. The methods advocated in principle are as Bhaya Darshana, that is causing fright, Vismapana, inducing surprises, Vismarana, obligation of memory, Shobhana, administration of irritants, Harshana, elation of spirits, Bhartsana, threats, Vadha or thrashing, Bandhana or bindings, Swapna, induction of hypnosis, and Samvahana, gentle massage. Many such psychotherapies are described in our texts. Pratidvandva Chikitsa is another interesting mode of treatment that is described. Mental disorders caused by emotions, for example, kama, that is passion or desire, shoka or grief, krodha or anger, bhaya or fear, etc., should be countered by their opposite emotions. Opposite emotions are promoted so that such mental disorders caused by emotions can be counteracted or can be inhibited or subsided. In Bhutonmada Chikitsa, a specific importance is given for the use of Purana Ghrita or Prapurana Ghrita or Kumbhi Sarpi, whatever it is. Simply, we can say that a Purana Grita, which is 10 to 100 years old, and of course, Rakshogna Dravyas. So, this is in general the line of treatment that is described. We can also promote Rasayana Chikitsa in the management of Unmada, specific, or psychological diseases in general. Always, any type of Rasayana Chikitsa has got a mental component. It may be Medhya Rasayana or Rasayana in general also. As these mental diseases are chronic diseases, Rasayana drugs have their own role to play, which may be Vacha, Guduchi, Shankhapushpi, or our mineral drugs like Swarna Bhasma, Rajata Bhasma, Abhraka Bhasma, Mukta Bhasma, etc. Sattvavajaya Chikitsa plays a very important role here. It is the non-pharmacological approach for treating the mental disorders, and probably it is comparable with the psychotherapy. It is based on the application of jnana, that is true understanding or spiritual knowledge, and vijnana, that is specific scriptural knowledge, by which spiritualism is brought into practical life. Dhairya, that is improving the mental tolerance to various emotional situations, resulting in minimizing the emotional responses. Or it may be smriti or memory, and samadhi, that means mental equanimity or a deep meditational status. So this is in general about the management of psychiatric disorders in Ayurveda, various approaches that we are following. Even though we are giving much importance to Sattvavajaya Chikitsa, even Daiva Vyapashraya Chikitsa also, Yukti Vyapashraya Chikitsa is very important in the management of psychiatric disorders. Apart from Shodhana Chikitsa, drug therapy or pharmacotherapy plays a very important role in managing various psychiatric illnesses. In Western medication also, pharmacotherapy or use of medicines is extremely important and popular, especially in the conditions like depression or in the conditions like schizophrenia. It is absolutely essential for them to use medicines. It's true in Ayurveda also. There is a very important role of Shamana Aushadhis, medicaments. These medicines may be herbal, herbomineral formulations. In practice, what we usually see is mostly herbal preparations are seen in the management of psychiatric illnesses. That too, Grita preparations. Of course, it is true that Grita has a unique role to play in psychiatric disorders. It can even pass through blood-brain barrier. It can concentrate the lipophilic drug in brain and may be very useful in the conditions like dementia, Alzheimer's disease, etc. But the problem with Grita preparations is its palatability. It's very difficult. Many patients do not accept it. They may even vomit. Apart from Grita preparations like Kalyanaka Grita, Brahmi Grita, Saraswata Grita, Chaitasya Grita, etc., there are only a few other herbal formulations. Maybe one or two arishtas like Saraswata Arishta or Churna like Saraswati Churna that are in practical use. Rasaushadhis are very, very rarely used. Maybe only a couple, like say Smriti Sagara Rasa, or because of the popularity in Keralian practice, Manasa Mitra Vataka. Many formulations are there which are never touched. So today's purpose of this presentation is to just produce an insight or just to motivate people to think in this direction that there are many very effective, highly acclaimed rasaushadhis which can be definitely used successfully in clinical practice. We know very well, we repeatedly tell this in various platforms that rasaushadhi are superior. Swalpa himatra vipala gunascha sadyohita deepanapachanascha. Or alpamatropayogitva daruchera prasangataha kshipramarugya doshati bhyuvadiporasa. In a smaller dose, more potency can be expected in rasaushadhi. Palatability is never an issue, and these products have very long shelf life. Because of the same reason, they are to be given much importance in the management of psychiatric disorders also. Today I will be touching upon a few of the formulations because it is very difficult to discuss each and every textual formulation mentioned under the category of rasaushadhi with indications in Manasaroga. We will try to cover at least the list of majority of such formulations. I have tried to classify these formulations that are useful in psychological disorders under the broad headings of rasaushadhi. Rasaushadhi are categorized on various bases. One of the classification is based on the types of murchana, which is mainly depending on the process that is involved. Accordingly, there are 4 types: Khalviya Rasayana, Parpati Rasayana, Kupipakva Rasayana, and Pottali Rasayana. Apart from this, we also have Bhasma, Pishtis, and unique preparations that are indicated in Unmada and Apasmada, that is Anjana. So under these 7 categories, I have tried to give you the list of rasaushadhis that are applicable in different types of Unmada, Atatva, Abhinivesha, and even in Apasmada.